This is One-on-One. Tomas Gregoria is a Senior Executive Director, Healthcare Delivery Systems, New Jersey Innovation Institute at NJIT. Good to see you, Tomas.
Good to see you, too.
By the way, what is this operation, the New Jersey Innovation Institute? What is it?
So it's a separate company spun off of NJIT to change how you innovate on certain company products, on certain networks, and I happen to be the executive director of the healthcare domain.
For example, give us a concrete example of what you do and why folks watching right now would say, hey, that's fascinating, I want to know more.
Right, so in '09, there were two large programs that created two networks. A network of providers. There was $36 billion invested in changing doctors' offices to electronic systems. So
electronic medical records?
Correct. So then when you go there, you know, instead of having paper charts, it's automated.
Got it.
Then there was another similar investment in creating networks of hospitals. So one of the things that our organization does is, you know, connect the networks of hospitals, which happens to be 5 in the Newark area.
Is that called the Highlander Health Data Network?
That's correct.
The Highlander Health Data Network. So these hospitals are connected. Why does that matter to me?
Okay, so the better your record is complete, the easier it is to effectuate change on your health.
Which hospitals?
Newark Beth Israel, East Orange, St. Michael's, Jersey City Medical Center, and Middle Lake.
So hold on. I go to Beth Israel.
That's right.
One of my favorite. Not that I like to go. My dad goes there. Okay, so we go to Newark Beth. I go to Newark Beth, but I was at St. Michael's 4 years ago.
Right.
So what?
So what? That data is now available for that physician to make a decision on something that may have happened that was collected in terms of information about your visit at St. Mike's.
Is it medical information? Is it financial information?
It's medical information.
Just medical?
That's correct. Results of tests that might have been done while you were at that other hospital.
What impact could this potentially have on how I'm treated and the outcome?
Well, it helps the provider have an understanding on, you know, your metabolic state not that long ago. We're working on a project where, you know, if medications were prescribed to you and you're supposed to take 2 a day, right, for a 30-day period.
Right.
But when you refill it 2 months later, and you've taken actually 1 a day. Well, that hurts the regiment of your treatment and getting better. So by collecting that data in that exchange, we can actually make a difference when we intervene with you as a patient. The doctor can.
But why would NJIT, the New Jersey Institute of Technology, and your operation there, why would you be so involved in healthcare?
Well, it's one of 5 verticals that we're interested in. We're interested in innovation in finance, innovation in civil engineering.
Homeland security, defense, finance, healthcare. Why is it that technology and healthcare, homeland security, defense, finance, why all those areas?
Because they were areas that were found to have the greatest opportunity to effectuate change by virtue of having this innovative program that we can dominate each one of these sectors.
So, okay, just give us an example. I know we're talking about healthcare primarily, but when it comes to security and, say, homeland security, I'm fascinated by the whole eye recognition thing. Georgette, what's it called again? You said? Or face recognition.
Right.
Is there a difference between face and eye thing, or is that the same thing?
Yeah, there is. It's ocular, and there's one that scans your face. There is a difference. Some of them have the ability to use both, but I looked at face recognition that's very much used in security and how a physician may be able to use it in healthcare. So we cross over to see how technologies that may be working in one area could work in another and affect it.
What's a login?
What's a login?
A doctor logs in. What does that mean?
So a doctor goes up to a computer, puts his name and number in.
Or her.
And then he has to do it to multiple systems. So imagine a doctor walking up to a computer and that happening for them just by recognizing their face. So these are the types of innovative things that we're trying to change to make it easier for them to be able to get that information to affect your health when they treat you.
How did you get into this whole thing?
I got into it as a way to pay for college many, many years ago, working at Presbyterian Hospital over 23 years ago.
But I don't understand, got into healthcare?
Yes. Yes.
So it wasn't technology that was driving you?
No, it was the mission of healthcare. I'm trained to take operational changes, use technology, and find ways to improve the overall ecosystem. I've been a consultant, I've been an administrator, and a chief information officer at a hospital. So I have a good understanding of what happens and what doesn't happen and needs to be fixed. So it's a very fulfilling job for me at this point in my career.
To what degree are pharmaceutical companies engaged or involved in cooperating?
They are very interested in the fact that prescriptions aren't refilled, because that means less revenue for them. So from a healthcare perspective, a clinician is very interested in you taking your medication, and the pharma companies are very interested in you renewing your prescriptions. So it's a symbiotic relationship that
But that's
benefits
good for
everyone.
them. But for consumers, don't we want to be driving costs down?
You do.
We're not that concerned about profits for them.
No, but it benefits both. But I'll give you an example. So there's discount cards that we can hard code into the computer so that when you go to the pharmacy, your copay may be lower. So those are all different ways that you affect and drive down costs.
This is fascinating stuff. Tomas Gregoria, Senior Executive Director of the Healthcare Delivery Systems, New Jersey Innovation Institute, tied to the great NJIT, New Jersey Institute of Technology. Thanks for joining us.
My pleasure.
Stay right there. Don't go anywhere. We got your face all programmed. Stay right back right after this. That was good.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, Activus, in cooperation with the American Medicine Chest Challenge, Virtua, New Jersey Manufacturers, Cone Resnick, New Jersey Natural Gas, and by the law firm of Gibbons PC. Promotional support provided by the Star Ledger, powering NJ.com, and by NJ Biz, all business, all New Jersey. Transportation provided by Airbrook Limousine,